Hey everyone, it is me, Dr. EVA Okindaya Apia. How are you guys doing? I'm going to wait for some people to come on in. But happy Saturday. I hope everyone's doing well. Basically, today's topic is a heavy one, a very heavy one. And I'm not proud of some of the things that have been going on recently, but we're going to make it through, you guys, okay? So here's the thing. Basically, today, what we're trying to focus on is, really this channel is really about trying to uplift and support health and wellness, in particular for people of color, and in particular for women of color. And with this whole trial that's taken place in the last week, there's just been so much, emotions and deep-seated hurt that's been going on. So I just wanted to come and talk to you guys, like from a healthcare perspective, why are these topics so important? And, in my opinion, why healthcare will never be the same. It's a really tough topic, but I, want to bring the information to you. Okay. Getting some notifications on here. And some of you guys might be also seeing me just in general or also on Instagram. Definitely make sure to check me out on YouTube, obviously here, and Instagram and Twitter. My name is on Twitter and Instagram is DRIVIEOA, so Dr. EVAOA for my name. Okay. Okay, guys, so let me just try and pull up some information here. I hope you guys can see my screen. Here, let me just do a quick check and see what's going on here. All right, good. Looks like it's going live. Oh, okay. Hi, poisnosologist. Hi. How are you? Okay. This is not easy, I tell you. Okay. So really the topic, the guilty verdict in the George Floyd murder and its impact on healthcare. My goodness, there's been so many emotions, and I honestly, my whole energy has been off for the last, it's ever since the trial's been going on. But anytime anything is going on in America that's very like racially biased or focused in particular on Black people, sometimes my energy is thrown off. And I know for me and my other friends, we've had to constantly reset our spirit, our energy. And what I want to urge, people who follow this channel is really just to understand your own needs and what it means to choose you each and every single day. Like, we have to really be in charge of our own health, be in charge of our own attitudes, our thoughts, and our behaviors. These things are all intertwined. And we've talked about that on prior lives that I've done, or prior content on this channel, and also on other shows that you guys have seen me on, including All About the Tea. But I just wanted to come to you guys and really just share with you from a healthcare perspective why this trial is completely different. Okay, and what's actually going on. Oh, thanks, poisonosologist. Good, thank you. Hope all is well with you. It is, thank you. But this has been heavy on my heart, and I have to, come to the people with it. So you guys may have heard of this term called social determinants of health. And what I want to urge people, especially in healthcare, because there are doctors who listen to this channel, there are nurses, there are providers, patients, is that in America, we failed George Floyd. And we have failed so many people who've been killed, unarmed Black men and women who've been killed in the custody of police. This is not an isolated incident, and at this point, we have to understand that race and racism is part of this social determinants of health. And so our paradigm and our understanding of the last several years has become heightened, more sharp, in our understanding about race and how it plays out. And in healthcare, it absolutely does play out. So let me just share this with you. This is actually a schematic from the Healthy People Initiative from 2030, which is part of the US Department of Health. Okay, and basically the premise of this whole concept is that there are multiple reasons of life that make up health and healthcare delivery, So I'll just show you. So of course, if you want to have good health, you need to have good healthcare access. So access to healthcare, do you have a doctor? Do you live next to or near hospitals or other facilities or providers? And healthcare quality. And part of the quality initiatives in hospitals I work at is, making sure that the appropriate labs and screening is done at the appropriate time. So these are really, really important, but it's more complicated than that. There are so many layers here. It's also about your zip code, ladies and gentlemen. Okay, so for example, where you live. Where you live is going to be, if there are more liquor stores and McDonald's in your environment than there are grocery stores, then that's going to play into the kinds of foods that you eat, because oftentimes we are a product of our environment. We really are. And unfortunately, there are people who are homeless, and that's so sad. For people who are homeless, you don't have time. Those people probably don't have time to be focusing on their healthcare if they don't even have a place to sleep. For me as a nephrologist, we want to be able to offer all modes of dialysis if people have end-stage kidney disease, right? And so if you don't have a home, you can't do peritoneal dialysis. You can't do home dialysis. That limits the healthcare resources we're going to be able to give you. So it's also about your neighborhood and your built environment. If you're seeing a bunch of lawyers, doctors, business people in your environment, you're more likely to become that, right? And be able to access healthcare in different ways because you're around people who are likely have a higher income value. So it's more than just doctors, okay? And then this is about community context, social and community context, and this is one of the biggest issues, okay? In that section of Minneapolis, right? First of all, this is not the first time this has happened across the country, that you have killing of unarmed Black men. This is something that unfortunately America knows all too well. And I think there had been previously narratives that, oh, this is an isolated incident. It's not. Unfortunately, as the trial was going on and as the verdict was being delivered, we actually saw that, unfortunately, there was another young girl, Black girl, who was killed in the hands of police, apparently just a few minutes from that area. So these are not isolated incidents. The context and what's going on in your environment absolutely matters. If there are big alcohol or drug issues in that environment, that's going to influence, what actually takes place in your own healthcare. Of course, economic stability. If you have more money, you may be more inclined to access healthcare, be able to afford drugs that may be high cost, and just focus. You can afford to take care of yourself and take care of your family in ways that set you up and set your family up for success. And people who are overall happy can have better healthcare. And then, of course, your education access and quality. PhDs and those who are educated and other high level and high performing people, they understand and have, perhaps enhanced literacy. Again, going back to access and quality to education, knowing that certain diseases or certain conditions are more appropriate in the emergency room versus in the clinic, and being able to discern that. So these are people who may have a leg up in trying to reduce their costs and things like that. So there's so many issues. And for George Floyd, I just feel so sickened, because this is a person who was just trying to make it. He was a hustler, and we all have moments and periods where we're trying to hustle, for sure. But unfortunately, a $20 counterfeit bill scenario got escalated and cost him his life. And it just sickens me. He was not supposed to die that day. He was not supposed to die that way. And I don't care if he had other issues, if he was an addict, if he was troubled in some way. That is none of our business. And he had every right to be dysfunctional in any way that he wanted, just like the rest of us. Okay? So my concern is that in America, we have failed him, and so many people like him, and not seeing the humanity in other people. And I feel that if racism exists in this country, and racism exists, unfortunately, in how we police people, then unfortunately, it also exists in healthcare and healthcare delivery. And we also have a beleaguered past, and we have to be honest about that. When we were talking about vaccines on a prior live, we had mentioned the Tuskegee Institute and the atrocities that was. You guys are probably familiar with the Henrietta Lacks story, when we unfortunately lied about the use of these stem cells and inappropriately used them. So there's a complicated historical context when we're talking about health issues that plague Black and brown bodies in this country. I hope what I'm saying is making sense. Please let me know what you think, but it's hard. It's extremely hard. It's tough, to be able to work with these topics, okay? So what I wanted to also just share is that, racism absolutely can impact quality healthcare. In the George Floyd scenario, unfortunately, we saw that there were people who were even saying, hey, stop. And this is just a picture of the crowd. You guys probably recognize a few of these people from the trial. I believe this is the boxer or fighter who, you work in healthcare, poisonologist? Okay. See, I would love to hear your perspective. So, maybe if you have time, you can call in, okay? But yeah, absolutely. We absolutely have seen warnings. We've seen warnings to say, hey, you're killing this man. You are killing this man. And this gentleman sounded the alarm. I believe this is the first responder who happened to be in the crowd and just was trying to offer healthcare, and actually was stopped, was told, no, step back. There were multiple people who were trying to intervene at that point, and it's disgusting. It's sad. And that's the point, is that racism can definitely and directly impact healthcare. Because this, for example, this healthcare worker had the tools and had the knowledge, okay, to be able to do something and intervene. And she was told no. She was told no. The next thing I also want to say is, like, look, we have to understand and recognize that white privilege exists, and sometimes, people, we have blind spots. We don't know, or we do know intentionally or unintentionally, but we have to be able to recognize that that there is a problem. And I think the first step is recognition and being honest. And I've even had my own sensitivity training, cultural sensitivity training. Of course, me showing up in the world as a Black woman makes it easier for me to recognize clear racial, cultural issues in healthcare, and how we, talk to patients, or how, things are actually implemented, in the hospital or in the clinic. There are just so many examples. For example, let me just say, I remember that in the past, I've worked with families from different religious backgrounds, right? And when we were having end-of-life discussions about a patient, the whole family would come in, and there would be, I won't say the exact background of this family, but there were a lot of people in the room. And I remember that some people on the healthcare team were complaining and saying, "Oh my gosh, there's too many people in here. It's like, it's just way too much. I feel uncomfortable." And I'm like, "No, you guys, you don't understand. In this religion and in this family, in their family culture, when one is sick, everybody rallies together, and that's in their culture, and they all want to show up, and they all want to show support. And sometimes there are racial or social cultural differences that translated in a pure white American context would have a completely different meaning. We have to be sensitive to that. And we have to respect that. Okay? So there are multiple perspectives, and just having that understanding and that sensitivity, even if there still are fewer people in the room, we have to approach people with grace, understanding that for that person and for that family, they're the authority, and we don't want to be able to impose our viewpoints on other people. It's just wrong. And sometimes these sensitivities are hard to recognize. Okay, so that's just a small example, but hopefully you guys who are in healthcare can understand, and those who've had family members who have been sick, you can understand how sometimes things don't always translate. Like, what goes on in your family can be hard to navigate when somebody is sick, or when there's a healthcare issue that pops up. I hope that's what I'm saying resonates with you guys, because this is just so deeply personal, honestly. And I'll be honest, just on a personal level, like, every day there are days that I've had to put on my doctor face versus like my face as a Black woman. I've had to sometimes split who I am, and it hurts. I'll tell you, emotionally, it can really hurt. Like, I have to compartmentalize different facets of who I am, whereas I'm not sure that some of my white male counterparts, that is the standard in healthcare, and that's the standard culture. But there are times where I've actually had to choose to compartmentalize issues that are going on, and ignore racial events that have gone on, just so I can make it throughout the day. And I know a lot of women understand what I'm talking about, Black people. anybody who has a non-traditional life in any way in this country, you've actually had to compartmentalize who you are. And I feel like for that person, for example, this woman, she's a provider, right? So she wants to be able to help, but at the same time, at the end of the day, in this context, she felt she had no power. And so I understand that need to like share parts of whom you are and parts of your identity, but being held back because she was instructed to do so. How many of you guys have had that experience where you've had to choose or section who you are for a specific moment or incident or event? I hope what I'm saying makes sense. So I could almost like feel her specific frustration. Oh, okay. So Dr. Carisha BDN is in the chat. Thank you so much and welcome to the chat. She says, I do it every day as I'm tasked to provide counseling services to law enforcement here. Wow. I'd love to hear your perspective. Thank you so much for what you do. Because first of all, I just want to just pause and say in healthcare, there's so many ways to be in healthcare. You don't necessarily have to be the surgeon, the doctor, the dentist. There's so many ways you can contribute to healthcare and healthcare delivery. We need lawyers, counselors, financial people. We need scientists, inventors to be able to contribute to the system that improves healthcare. So Dr. Carisha BDN Inc., thank you so much for what you do. And it's extremely important. So, counseling. If these people had counseling, I'm talking about Chauvin and the other people on the police force, they may have. I don't know, they may have. But I'm just so sad. Okay, next comment, again from Dr. Carisha. I'm fragmented as a Black woman, a physiatrist, a mom to a Black man, etc. It's very taxing. Absolutely. Absolutely. Just a second, I want to see if I want to be able to, I'm learning StreamYard, you guys, so just bear with me. Okay, so hopefully you can see that. I want to be able to share my screen with you guys. Okay, I'm learning, you guys. On this platform, I'm trying to grow and get more into the technology, so it's not easy. But I just wanted to be able to highlight what she's saying. Dr. Carisha BDN, thank you so much. Every day I've had to, especially in the last couple of years, just segment myself. And I'm a wife, I'm not a mom, so I can only imagine, especially being a mom to Black children. See, the problem is that children are not allowed to be children. Like, Black boys and girls can't really be children and be innocent anymore because we're dying. We're dying, and we can't be innocent, and we have to be aware that these things exist, and your life is potentially at stake on a daily basis. Can you imagine what that does to the brain and development and just life? It's just generations down the line will have a better understanding of the psychological, emotional impact of all of these issues, I tell you. Next, I wanted just to move on to the fact that first aid saves lives. Okay, so how many of you guys have encountered some event right in front of you where someone faints or suddenly draws ill, and it's like, oh my gosh, what do? I just call 911. That's a first step. But I want to encourage people who don't even have medical training. You can actually learn first aid. And so I just wanted to show a picture here of two people, practicing on a dummy, that basically, you know what, we have to be able to understand and recognize when people are going down. We have to be able to understand and recognize what's most important, which is maintaining good blood pressure. Okay, so some of you in here are healthcare workers or providers, so I'm not going to, tell you how to do what you already probably know how to do. But for those who are not and in the general population or have no healthcare experience, this is just so important, being able to learn how to check a pulse, see if someone is breathing. And unfortunately, in George Floyd's scenario, there were so many opportunities for this man to live. There were so many opportunities. But these police, those 4 police are collectively responsible. It's not just Chauvin as far as I'm concerned. And even the bystanders, there were healthcare workers who were in the crowd and who were willing to help. So unfortunately, George Floyd, there's nothing we can do about that now. Unfortunately, he's died. But I just want to be able to share with you all that you have power. Okay, in knowledge, in being able to how to assess a situation and try and help neutralize it and call for help. That's really the biggest thing, is recognizing someone is going down, and calling for help. Having someone call for 911 is the biggest thing. And unfortunately, in George Floyd's scenario, we had a healthcare worker on the scene. We had healthcare workers eventually come to the scene. Okay, but unfortunately, that was still the outcome. Had that gentleman, Floyd, Mr. Floyd, gotten health care earlier, he may have been alive. Independent of what this evil police officer did. If there were opportunities earlier to save his life with first aid, then he may be alive today. He may be alive today. But what I'm just trying to recognize is I just want to encourage people to go ahead and arm yourselves and get first aid as soon as you can. Get training in first aid, I should say. And honestly, this has actually saved, oh my gosh, I could even get emotional. This is something I remember even as a child. There was a close family member. I didn't ask him for permission, so I won't share the details. But I remember someone in my family had an asthma attack right in front of me, and I didn't really know what to do. I was 10 years old. Eventually, me and my siblings, we called the police. But I saw this person, a grown adult, suffering. And I felt so helpless. It honestly scared me so much. And it's one of the defining moments where I decided I want to be a physician because I want to be able to respond and do something. So I'm just saying that even in your own life, if you have a spouse or a child who suddenly falls ill in front of you, passes out, or for our people, sometimes we turn an unusual color, like a dusky gray color, like, for the chocolate boys and girls like me. Sometimes we can turn a color, and just even being able to recognize, like, ooh, something's wrong with my child. Something is wrong with my husband. And that's something I counsel, like people who come and see me in the clinic or whom I meet. I encourage the spouses to understand each other's healthcare issues. Like, for example, if you have a spouse that has asthma, this is a free tip. You need to know where 2 or 3 inhalers are. There should be an inhaler at your spouse's office or wherever he or she works. There should be an inhaler always in the car, and at least 2 inhalers in the home. So no matter where you are, there's an inhaler. And the inhaler is a device that helps to open up the airways, and it can be really helpful in people who have asthma. It relaxes the breathing airway so that you can actually be able to breathe, and it can save people's lives. Something so simple, just having access to it. So if that person or if your spouse all of a sudden has an attack, it's hard for them to be stumbling around trying to find an inhaler when they're already in a panic mode or compromised. Sometimes you may be the one to save that person's life. But anyway, so I have more tips and tricks on that. That's a whole nother conversation, but I just want to encourage people to feel empowered, even in your own homes. Unfortunately, those who had first aid knowledge, it did not help in this specific situation, but I want to encourage you all to get first aid training. Okay, so I'm seeing a comment here, a blessing for you. Hi, thank you so much. Welcome to the channel. Let me just, okay, yeah, welcome. Okay, so next, I have so many things to talk about. I'll just tell you right now, I serve on a few committees in healthcare, right? Where we talk about responses to racism and how healthcare can impact that. So, even I work with the American Society of Nephrology on their policy and advocacy committee, and I think I was sharing with you guys on social media that I've been trying to work with congressional staffers to encourage kidney disease research and funding and all that, but in particular also for Black patients. And I'm trying, you guys, to just educate myself, understand the real issues that are facing Americans, with particular emphasis on Black and brown people. And what I'm learning is look, healthcare is not just about pushing pills and pushing prescriptions. And I know that's a big, that's a big view of healthcare. It's oh, it's just a script and, get out of my face. No. I think as a society and in healthcare in general, we have a better understanding of social determinants of health that we just talked about, but also how medicine can actually interact with social justice issues. Barbara Lee, out of California, the politician out of California, she coined the term that we are fighting a pandemic within a pandemic. Of course, coronavirus being one of the pandemics, and then the other pandemic, of course, is racism. And they're always interacting. Race and healthcare are always interacting. At a certain point, when we were protesting the George Floyd thing, last year, there were questions about how do I protest safely and not catch coronavirus? And we constantly are having to choose how we risk our lives on a daily basis. And knowing that Black people are more likely to die, catch it and die, unfortunately, of coronavirus. There are times where we've had to interact with these things. Now, I put this picture up of Dr. Chauvin. You guys may be familiar with who he is or have seen him on the news. He actually was one of the most amazing medical expert witnesses I have ever seen. And he testified in the Chauvin trial as a pulmonologist. And I'll just tell you, he is brilliant. He's actually a respiratory physiologist, so he's not just an MD, he's also a scientist. Two different things, but they can exist in the same person. So someone who has not just medical training, but scientific training. And they're related, but he really is the real deal. And actually, I'll be honest, he taught me in my residency program. So I actually went to Loyola University of Chicago, on the west end of Chicago, and he actually was one of my supervising physicians and directly taught me. And I remember meeting him. He's just so brilliant and honestly like intimidating because he's extremely brilliant. All of the fellows at my hospital were like encouraged / required to read his textbook, like one of the leading textbooks in respiratory physiology. So he understands lung physiology and mechanics like nobody. He's like really like the godfather of all these things. And he actually testified on the trial and was showing the science of how this man died. George Floyd died. It was disgusting. Because of all the, I only showed his picture. I'm not going to show some of his diagrams that were displayed in the trial because I just feel for those of us who are a little bit triggered, I just didn't want to re-expose you guys, but you can look it up. It's, if you just Google it, you'll find it. But basically, he was showing how George Floyd being flat on the ground inhibits his ability to breathe. And not only that, Chauvin putting his weight on his neck and the other officers on his back and or legs completely crushed his chest wall, and the ability for him to expand his chest wall to incorporate, to allow him to actually inhale and sustain his cardiopulmonary system. He literally shared the physics and the science behind why this man died. And here's my thing. It's like you never know what your life experience or your knowledge, when it's going to come in handy. Dr. Chauvin, I believe he's from Ireland, don't quote me on that, but he's European. He probably didn't, think he was going to be a doctor and anticipate going into a trial to talk about how someone physically died. First of all, we have video proof that this man died directly but under the hands of police. So I don't know why we have to, what's there to discuss, really. But it tells you that you never know when knowledge will be helpful. All the things that you've gone through in your own personal life, you just never know when it's going to actually be relevant. Dr. Chauvin was a key person in helping to bring justice for this man. And I'm honored. And I feel so lucky to have known him, to work under him. And that's my point, is that medicine actually can interact with social justice issues. If Black people are dying at a disproportionate rate compared to white people on any disease, and it's true for most diseases out there, then that's a justice issue. That's a social issue. So for those of you who want to help your people or help communities, healthcare is a way actually to do that. In my community, just being a Black woman in healthcare, just my very existence, I'll get to that in a little bit, but just my very existence is revolutionary because there aren't that many Black women in medicine. There just aren't. And so anytime I'm speaking with people who look like me, there's just a different level of understanding, period. Okay, I hope what I'm saying makes sense, and you're really just feeling what I'm saying, because I'm really speaking from my heart and my brain. There are times where I have to, again, back to the segmenting issue. There are times where I've had to just compartmentalize who I am. But these days, I can't. And let me just show this. Seeing Dr. Chauvin on the screen on like CNN and MSNBC are ways that I'm like, wow, my world and my life as a physician is colliding with who I am as a Black woman. and they're colliding on it, honestly, on a daily basis. And it's like something in my brain, like kind of short circuits. It's like, it's crazy. It's crazy. But I think hopefully a lot of you guys probably understand can relate to what I'm saying, or, what I'm feeling. You are welcome. A blessing for you. I'm just seeing some of your comments here. Okay. I just want to end with this schematic here. This is a figure from the American Association of Medical Colleges that identified the racial makeup of physicians in America. And this is relatively new data, 2018. And you can see, according to their numbers, about 56% of physicians are white, 17% are Asian. So when we're talking about underrepresentation in healthcare, it also applies to our providers or physicians, you guys. So you guys know that about 13 to 14% of the population is Black. Tell me why we only have about 5% of the Black of the physician population being Black. So even though we comprise of about 13, 14% of the population, we only make up about 5% of physicians, meaning that there's underrepresentation in medicine. And I'm sure I wonder if that's also true. I imagine it's also true for dentists or other healthcare providing and ancillary services. So it's, that's not a shock. And there's so many reasons as to why that is, even in, it just issues in school. Teachers definitely in the past have looked at me differently. I've been told I'm not smart enough, I'm not going to make it. But I've had incredible parents and support system friends, other doctors who have encouraged me, because there were times truly I wanted to quit. I didn't want to do it because it's just too much. There's too much emotional, turmoil. I just want to highlight this comment from A Blessing, because this is extremely important. Extremely important. The A Blessing for you just said the underrepresentation is very loud in the Black, Brown, Afro-Indigenous communities. It is just sad. Absolutely. Exactly. Yes, exactly. Native Hawaiian or Pacific Islander is a small percentage. Native American or Indigenous persons, certainly also in the Hispanic population. It is sad. But there's so many reasons, like from birth, where I could say, because you can't just wake up one day and decide I'm going to be a doctor. It's a long-term planning. There's some work I've been doing for decades. It's not just medicine that requires long-term planning. Almost like anything, like law or nursing, business. There's a lot of people, a lot of professions that require focus early on in school or resources. I'll tell you one thing, you have to be ahead to get ahead. For me to even get to this point, I needed help. I needed student loans. I needed money to even apply to medical schools, let alone get into med schools. I needed money to apply for programs so that I can be competitive. I needed money. If you don't have a lot of money, you're already at a disadvantage. Okay? So when we're talking about caring for Americans, especially people of color, it's not just in policing. You know how they're always talking about you need people who are of the community, not just police the community. Like they need to be people who, these police officers need to be of the community and understand the unique needs of that community rather than just being from a different community and patrolling or policing. It's just a completely different context, right? I think that same concept also applies in healthcare, right? It's just a completely different field. Me as a patient, when I'm speaking with a woman or another Black woman provider, it's just a completely different level of understanding. Now, I don't mind having white male doctors. That's fine for me because I can connect with that person because I'm also of the community of healthcare. So there's some things that I innately know and understand, and I'm educated enough and understand the system enough to question or engage, right? But not all people have that. So that's what I'm saying. Oh, thanks. So that's what I'm saying. It's like we all have this. We have to play the long game. We have to play the long game. And this trial is just opened my eyes, and I just feel healthcare should never, ever be the same. We now know, if there was any question, we now know that white supremacy and white privilege kills. If we're concerned about guns being a public health issue, we too need to be concerned about the killing of unarmed Black and brown boys and girls, period. Okay, so let me, I just want to stop sharing my screen and just kind of open up the discussion. So, a blessing for you. I'm a social worker for family services and I speak 3 languages. Wow, you're talented. What languages do you speak? And it has been a fight for me in the field because they keep trying to see us like we don't matter or not important enough. I can totally relate. And see, that's the thing. It's like I just feel like sometimes we have to be perfect. Like just perfect. And I don't mean just on the job, but like literally just being about in my everyday life, being perfect. It's too much. It's too much pressure. You also made another amazing comment. What was it? What was it? Yeah, I personally know what you were talking about, Dr. Evie, and I'm glad I caught your live. I'm so glad you were able to catch it too. You know what? I really appreciate all your commentary as well. Please feel free to call in. Let me see how to. Okay. I'm just going to drop the link if it will work here. Okay, so I dropped the link for people to be able to call in if you'd like. But yeah, you know, going back to that concept of like, you know, having to split myself and, you know, there are days I'm a physician only or days that I'm a Black woman only, but when they collide and sometimes I have to choose, like, how do I approach this situation? I'll tell you was when some time ago, I was on call in the middle of the night and I remember getting pulled over. Okay, trying to see a patient. And I was honest, I'm going to be honest, I was scared. I was scared and I was nervous because, this person, the police officer that came was like, I felt like being a little bit, I just was scared. So, I mean, I honestly, I was just scared. And I felt like, being directed as to do this, do that. I just was like, I was so nervous. And it's like, I have no control here. The fact that I'm a physician, it's complete, almost like irrelevant here. It's just hard. It's hard. Okay, so it looks like we have a caller, poised nosologist. Are you ready? Can I add you? Okay, I'm gonna add you in.
Hi, Dr. EJ. How are
Hi,
you?
how are you?
Good, good. I'm so glad you're doing this live. It's really informative. Everything you're saying, I truly understand. I was on a committee that we were for another hospital in New York that we were actually going to the Bronx and going into their clinics and like observing them because they found that some of the clinics in the Bronx were doing like a great job with the way that their clinics were almost like family like and um, the way that the healthcare was being delivered. It was for the Montefiore healthcare system.
Oh, good.
They were getting it right. So the other healthcare system had us as a committee go in to see what we could learn from it, you know. And the things like that I saw were I learned so much because like but I've also worked in the ER.
Right.
So I've seen the bias that it was just overwhelming. Some nights you do leave overwhelmed. I'm a Hispanic woman, but I was married to black men and so my children are biracial and
Oh,
I've like firsthand experienced it, watched my husbands and children go through that. So I like have a zero tolerance for it. So I truly understand like where you come from when you say like you have to be a doctor and then a black woman. I say never do that. Like I know I can't really say never do that, but I think it's gotten me in so much trouble because I will never do it. I've been fired from many places. I've walked away because can't I can't deal with the bias. Like I can't do it. I won't do it. I've been promoted, like started whole programs. I work in the money side and the
wow.
coding side of it, and God has shown me so much favor in the healthcare field. Like I'm not supposed to be in the boardrooms that God has put me in. He's allowed me to use my voice in the field. Like I've watched, other people say, as in the ER. Go over to her. She'll register you. She could speak Spanish. I don't want to, yeah, go over there. Go over there.
Yeah,
Bet that, stuff like that. So I know exactly firsthand what you're talking about. It happens so much in the ER, a lot because of the people that, like I worked in low income areas. And so the traumas, and then you'll hear things like, oh, it's Friday night. You know what that means. All the drunk Mexicans or all the,
hmm,
let's get
yeah,
ready for the shootouts or stuff like that. So I know even when the police come into
hurtful.
the ER,
Right.
when the police come into the ER, I hear the conversations they're having with the nurses and the doctors. So I know even I'm not gonna even pretend I've seen them do things like that even to like women rape victims. So women even get like short end of the stick sometimes, like they don't even believe them or stuff like that.
Yeah,
So it's rough in the healthcare system overall, in general, just in general right now. Like it is a difficult situation, but it is really important for us to just keep fighting the fight and standing up, and like you said, bringing more Black people into healthcare, because more and more that are there representing the patients, representing it can help it in some way. But as a person that collects data in healthcare and does a lot of data, we've been collecting data for so many years, and we're just now starting to figure out what to do with the data.
Hmm.
Like
Can I just say, first of all, thank you for calling in. I totally respect your point of view. And, I honestly, I can relate. It's really sad. And I just want to clarify, when I say there are times I've had to choose, what I mean is that sometimes in my life or my experience, I've had to just focus on
what you
the work.
do.
Yeah, what I'm doing and the work. And I don't have time to like even process or understand my own emotions about things outside of work. Does what I'm saying make sense?
Yeah, you know what? It's because I am like an emotional person. Like I'll wear my hand on my sleeve, so that's why I feel like it interferes with me at times.
Well, I'm
But
emotional too.
but I understand what you're saying. You do have to
Yeah,
focus on the job at hand and
it's
what's
just
best for the
hard.
patient and not get caught up in the politics because it could be overwhelming. You can leave like just in despair every day if you did that.
Right, exactly. And I'm
And
not
we
saying
don't. We're not there for that. We're there to help. We're there to give hope in healthcare.
exactly,
We're there to give
exactly.
care. I've been working in healthcare a long time, and I actually feel like I'm not getting the care that I need. Like I've been trying to get the care that I need, and and then when coronavirus came in, I felt like forget it. I'm not getting it at all now. Like I the telephone calls, like I've had to chop off all of my hair. My hair used to be like down to my back, and like I have autoimmune diseases, and it's just been really difficult
Hmm.
getting good quality healthcare, and I'm in the healthcare
I was
system.
just gonna say,
And
isn't
so it
that
has
sad?
been overwhelming for me, like, to say like you know what I found my biggest problem is I don't feel like they allow me to participate in my care. I'll give you an example. So I was really not doing well, and my rheumatologist wanted a muscle biopsy. But I had no one to care for me or my child. So I couldn't go get
Oh,
the at that time. Like I literally had no one. My
nobody.
oldest had left to live in Texas and it was just me and my youngest, and I she literally refused to give me the prednisone unless I went and got the muscle biopsy.
Oh, it's so hard.
So I was without prednisone and I ended up in the Urgy Center, and the Urgy Center gave me the prednisone just to get out of that flare from
Right.
me.
Yeah, yeah. I'm sorry. That's frustrating. And I'm not gonna, you know, I don't know the exact
Right, right. No,
situation,
I'm
but
just saying that sometimes if we
yeah.
don't stand up really hard for ourselves, or if we don't say like, look, we can participate in this care, like not that I'm trying to be a doctor.
Yeah, but you physically could not go. You literally could not go. See, and that's the thing, is that sometimes we have these extra hair. We have these extra burdens too. In particular, like Black and brown bodies. I'll give you an example. Like okay, I had somebody close to me who was going to work, and the person, he's a healthcare provider. I'll just say that, going to work. Unfortunately, he got pulled over. And then, it turned out fine, but there was, a little bit of a delay, with traffic. Like if you don't go at a certain time and you're delayed by 15 minutes or something, you could be 45 minutes or an hour late because of,
Right.
the traffic patterns. So one of my, somebody I know was in that scenario, and his boss was like, but I need the proof that where's the proof that we were pulled over? Why didn't you respond to me when you were pulled over? Like, why didn't you text me that you were pulled over? Like, if you were really pulled over. He's like, I texted you, you didn't answer. And my friend had to explain, like, look, I'm a Black man. I can't reach for my phone. Do you get what I mean? And actually, you should be happy I'm alive, honestly. Not to say, and I don't want to overgeneralize
No, I
and
know
say
what you
that
mean.
every police encounter leads to that, but
No.
there are clear patterns of escalation in this country that we have to be clear about.
Yeah.
I, as a friend, was just happy that he survived. Straight up. I was just like,
Right.
okay, you know what? Good, you made it. let's let's deal with it. But also that emotional, and like, we are hemorrhaging emotional energy on a daily basis. Do you get what I mean?
Yes.
Black and
Yes.
brown bodies, it's like that constant stress.
Mhm.
Tell me that doesn't have any impact on our healthcare.
Absolutely.
You know, we're
Stress.
probably pumping cortisol, stress hormones, just on a daily. And I'm not even saying just being pulled over. I'm just saying to be black or brown, or in some such women. You know, if you have a non-traditional life, you know, there are certain things that we have to go through, and people are not understanding that level of sensitivity. It, it's just sometimes that grace and understanding, it's just not there. So tell me, if you were late for an important interview, how are you going to get to the next level and explain, look, I was pulled over by the police, this is this. Do you get what I mean? Like,
Yes.
what if that was a specific day that was critical to his professional advancement? It's just, you know, potentially ruined. Whereas sometimes our, you know, other counterparts can just,
Yep. Yes. Yes.
that
Yes.
you know, just walk in and, you know, be a few minutes late and, you know, like, oh, you know, it's all good. No, we have to be perfect, like near perfect.
I live right near, I'm 5 minutes from where Eric Garner was killed by
Oh
the police.
gosh.
I literally, my daughter goes to that beauty supply all the time, like not as much now, but that devastated me. And you know, his daughter fought so hard after his death. She fought hard and loved that girl. Do you know when she died of a heart attack, they immediately burnt his memorial by the beauty
Oh,
supply we were happen at? I was devastated. There
I'm
is no
sorry.
longer like a memorial, like they removed it.
I didn't even know that. I didn't
I
know.
was devastated the day she had the heart attack, like maybe 2 days later, it was gone.
I'm so
And it's
sorry to hear
and
that.
there has been no improvement in that area. They just recently started improving that
Hmm.
area now. Like that should have never happened to him.
Right.
That is if that like, I feel like if that would have had a better outcome, like they waited 5 years to even fire the man, we wouldn't even be talking about George Floyd. You know what I mean? Because that Eric Gardner situation, they did not pursue that cop enough. Like
It's
that was.
sad. We need to do better. We need to do better. You know,
I'm
poisonologist.
sorry. I'm sorry. I feel like I'm talking to a friend. Forgive me. I love you.
Yeah,
I feel like
but
I could
that's the
talk
point.
to you
This
all
is a
day.
platform for us, you know, to
Yes.
talk about these issues and offer perspective. And, you know, please definitely, you know,
Yes. Thank
follow
you. You do
me.
and you'll do
Yeah.
what? Yes, I'm gonna stay. Now that I found your channel, I just recently found it. I was trying to
Thank
find it,
you.
and it's great. Have a blessed day.
Thank
Enjoy.
you. Oh, you're so sweet. And I appreciate all of your comments. Okay, call back soon, okay?
Yes, bye.
Okay, bye. Okay. So I'm gonna drop the link. Let me see. I'm gonna drop the link for anyone else who may want to call in. But in the meantime, I just wanted to say a blessing for you. You are so on it. I love this comment, and people are so miseducated because they even believe that just because someone has a Spanish last name doesn't mean English. They don't speak English. It's like, really, you guys? Exactly. Exactly. I think, you know what? We have biases, and it's good sometimes when you just point it out, you know, in a loving way, as long as they're, depending on the situation, just pointing out, say, hey guys, I mean, he probably speaks English or she probably speaks English. You know, it's hard. What are you talking about? Blessing for you. I was pulled over by an officer and my words are not sufficient for you. It's like, oh my gosh. Yes. I was just like, wow, tone deaf. It's sad. It's really sad, but you know, that's really what this platform is about. It's community. It's community. how can we create more health and wellness, especially for Black people, Black women? I have a lot of, topic ideas, and I want your feedback on them. Just tell me what you want to listen to, what topics you want to hear. I mean, I know for me as a physician, my life is just never the same. In the last few years, everything that's gone on and everything that's gone on with the Black Lives Matter movement, I'm not the same. I remember thinking, like, at the beginning of the pandemic last year, you know what? My gosh, I was seeing more and more data about Black people dying more than our white counterparts from coronavirus. And it's like, I kept hearing about it. Then I looked at the studies myself, and, I wasn't surprised, but I kept thinking, oh my gosh, someone should do something. Someone should explain why masks are important. Someone should do something. And I kept thinking, what about our Black people? We need more doctors speaking up and speaking out, especially for Black issues. And I'm like, oh my gosh, dummy, that's me. That should be me. When you're like, oh my gosh, someone should do something, somebody do something. I'm going to be honest. I'm like, oh my gosh, that should be me. Okay, it looks like we have someone else, Denise Ramos. I hope you're ready. I'm going to add you to the chat. Okay.
Hey, Dr. Evie.
Hi, Miss Denise Ramos. How are you?
Good, how are you?
I'm okay. Happy Saturday.
Thank you. I didn't put my camera because I'm still on the bed. I just caught you live and I was like, you know what? Let me just stay here. I like the topic.
Oh, you're so sweet. Thank you for joining us.
Sure. I just feel like the topic this morning is so like on point, and with the biases and in the medical field, I guess in any field. So it's just like, man, I'm so glad that you touched on that, because that is something that is so tangible and vivid to me, working with the families or just the regular everyday, again, register a patient or someone being referred to you, and just because they have a Spanish last name, oh, here go Denise, get your people. That's one more person to your caseload. And I'd be like, you guys sound so not intelligent right now. So not intelligent right now, because they assume just because you have a Spanish last name, there's people who have Spanish last name who were born and raised in this country. Why make you believe you speak English? So it's like, man, come on.
I mean, absolutely. But I totally agree. I know sometimes people are not, they're just not aware that what they're saying could be offensive.
Yes. Mm-hmm.
It's different if you're like, hey, this person may be Spanish speaking only, be ready. We might need your help. That's different, right? That tone.
The deliverance.
And the delivery.
Mm-hmm.
The issue is not that you're going to have more people on your list. The issue is like your attitude. Sometimes these people's attitude. And I'm not trying to bash anybody, but what I'm saying is we have to be honest.
Yeah. And it's not about bashing, Dr. Evie. It's about you telling the truth.
Yeah.
Because this topic is something that people live every day. This is not just, oh, I heard that this happened to such and such. No, this is happening. When I go to work on Monday morning, this might happen to me.
100%. And thank you. Are you also in healthcare as well? Is that?
Yeah, I'm a social service caseworker.
Okay.
So I'm a social worker, yeah.
So thank you for the work that you do. We need great social workers, and people can go in all different directions. But I'm sometimes like best friends with these social workers when I'm, admitting or discharging a patient. We have to be.
Yeah, it's a team,
right?
Yes, definitely.
You guys are so important.
Yeah, definitely.
In fact, we have our social work rounds, like at some of the hospitals I work at. We need to have separate meetings to prepare the patient for discharge, and we need to make sure that there's a support person in the home, that they have all the medical equipment and that delivery is done before we discharge. All these things. Sometimes people think, oh, what do they really do all day? You just see the patients and
a lot.
No, right? Right?
I love it's so funny because it was one day my husband was talking to me and he's like, I'm gonna pass by your job and I'm gonna drop something off. And I was like, okay. And he will normally walk in and he's like, some I don't want you to feel bad. He and I was like, what do you mean? I just don't understand when you kind of share with me that you're so stressed. And I walked into your office and you're sitting on your desk and you're putting your notes in and you're just listening to these people problem. And I'm like, that's mentally draining.
Yes. Yeah.
You don't understand. These people who come to my office, I might be in a good mood or like my morning just started and someone just show up and like domestic violence situation. The
Yeah.
guy burned the whole apartment. When I walked into the apartment, there's holes on the wall.
Mm,
He took my ID. I can't go and change my wig checks for my baby. It's like, this is serious.
serious. And you guys see things like directly up close in a
Yes.
lot of situations. So we have to, honor and respect social workers for sure. So honestly, kudos to you. And you know what? Also, I just also wanted just to say that, healthcare workers and anyone who actually cares for people, you don't have to be
Mhm.
necessarily a doctor. This applies in general. If you're
Yes.
caring for people or sometimes there are people who care for people at home,
Yes.
that can be emotionally draining too.
Yes.
Even though you seems like you have a heart for giving and service, but also over time that can really take a toll and people do get burnt out.
Yes.
People
Yes.
do, and that's a truth that I think is being more recognized.
Mhm.
But yeah, we're not playing with people's lives. Like this is
Yeah.
not a theoretical
It's
thing.
serious.
Someone's life literally in your hands.
Mhm.
So I respect what you do and thank you.
Thank you. Thank you for the time. Thank you for allowing me to speak.
Of course. Of
Sure.
course. Of course. It's my pleasure. And, like I said, definitely, continue just to, help me and follow me.
Sure.
Like I said, I'm trying to grow my platform. So I'm glad that you like the topic. It's just something
Yeah.
that was like on my spirit and my heart.
Mhm.
I have some other ideas and like, trying to encourage women and Black women, Black men and women to get into
Yeah.
medicine and,
Mhm.
how to put together our portfolio. Because there's some
Mhm.
unique things that, like, you can Google it, like, get this grade and get that score and all that. But there's a system. And
To it.
yes, there's a system and there are ways to get it done that I think
Yeah.
we have our own unique challenges,
Mhm. Mhm.
So
Yes.
that's something I want to encourage. And but yeah, like if you have any topics you or others, like share this video, and this is, like I said, our platform and our community.
Sure.
Yeah.
And it's doable. You're gonna see that you're gonna grow your channel and you're just gonna be like, man, I can't even fathom all this that I'm going through with my channel. You got this, Dr. Evia.
Thank you. I'm new to this. I kept thinking, oh my gosh, someone should do something. I got a social
No.
media because of this whole pandemic. This is really a brainchild of the pandemic, and it's people like you and others, you know, um, poisonologists and others,
Mhm.
who are really encouraging me. And it's like, oh, I can't stop. I
And it's
can't
needed.
let go.
It's so needed because again, even though that we already have a vaccine for COVID, the people are not, they still cringing to go outside. So if they have this channels or community that they can go to and get information, it's helpful. You're
Yeah.
doing something big. Yeah.
Oh, thank you so much. Thank you. Okay.
Welcome. Sure.
Well, I'll be on the lookout for you, okay?
Sure.
Definitely call back in, okay?
All right.
Have a wonderful Saturday.
You too.
Bye. All right. Thanks, poisonologist. You're telling me I'm doing great. Thank you. I need your guys' encouragement. Okay, so I will drop the link one more time for anyone who may want to call in, but I'll just kind of really start to close and just say thank you to everyone who's on this live. And for those of you who are watching, whenever you do, I'm humbled, I'm honored. We are trying to do something big and trying to grow this platform. I have some topic ideas I want to run by some of you guys, so just let me know. Let me know what your thoughts are, okay? Here. Miss Empowered Woman. Beautiful. Ooh. So happy for your platform, Dr. EVA. Looking forward to other topics in the future. Thank you. Thank you for the encouragement. Like I said, I'm new to this. This is not my wheelhouse at all, but I do like to talk and I can relate to people, so I appreciate it. But yeah, definitely encouraging our Black boys and girls to get into healthcare, and it's never too late. Just because you're 40 doesn't mean it's too late. If you have children, there's an opportunity to encourage them too. I actually also do that as well. And then I also do research as well. I study kidney disease. As you guys know, I'm a nephrologist also in training, and which is a kidney doctor. So I also do clinical research about how to improve women's health for kidney disease and outcomes for pregnancy, fertility, contraception. So once my paper is published, I will be sharing some of my research with you all, and also some women's health topics, Okay. So a pleasure to talk to you guys this Saturday morning. I will be around. Definitely like and subscribe, share, and follow me on Instagram at DRIVIEOA, Dr. EVAOA. Also follow me on Twitter, Dr. EVAOA with the same handle. It's been amazing, okay? We'll talk to you soon. All right. Bye.